This video is to help you remember the Glasgow Coma Scale a little easier, or at least we hope it's easier. So the first thing to know is the three sections that are scored, and it goes eye, mouth, motor. And conveniently, the numbers are 4, 5, 6. Eyes, you have 4 options, verbal, you have 5 options, and motor, you have 6. The other thing to remember is the lowest score is never a 0. The lowest score somebody can get in each section is a 1, which means the patient at minimum can get a 3. So first, in eye opening, it's important to always know that the highest number is normal and the bottom number is none. And that is true in all 3 categories. So then really we only have to remember the middle scores. So in eye opening, because there's only 4 choices, there's only 2 middle scores that we have to remember. And so a number 3 is when somebody opens their eyes to you commanding them. And then a number 2 is somebody opening their eyes to you, giving them a little pain or pressure. And that's the stimulus point, like we talk about. You could do a sternal rub, you could do the trapezius squeeze or the mandibular pressure to try to get them to open their eyes to you. In verbal response, we have 5 choices. So 5 is normal, none is 1, and then we have 3 choices in between to fill in. Again, if you ask them a question and they respond to you correctly, that is a 4. If you ask them a question but they respond to you incorrectly, they're kind of off topic, that is a 3. And if they respond to you but they're incomprehensible, maybe they're muttering, you can't really understand what they're saying, that is a 2. In motor response, we have 6 choices. This one's the most to remember, but the easier way is to remember that the 4 options between the normal and none, 2 of them have to do with pain and 2 of them have to do with posture. So normal is a 6, but then a 5 is when we're trying to get a response based on one of those stimulus pressure points again. If they kind of push you away when you do that, that is a better response than if they withdraw from you and kind of try to pull away from the sternal rub you might be doing to them. So pushing away is a 5, pulling back from you is a 4. And then we have our 2 posture options. Decorticate posture is better than decerebrate. Decorticate posturing is when you look at them in the bed and they're kind of pulled into their core, their hands are pulled in, and that is better than decerebrate posture. Decerebrate, if you can find that B in the word, you can remember B for the word brainstem. And that means that the injury has reached the brainstem, which is not good. And that starts to make the patient appear more like straight like a stem in the bed with their hands turned out. And then of course those postures are higher numbers than just no posturing at all or being flaccid in the bed. So hopefully that helps. Another little trick is to remember that if your patient scores 9 or above, 9 is fine. And if they score 8 or below, 8 intubate. Hopefully that helps you with their Glasgow Coma Scale.